Good morning, everyone. Today, we will explore the development of sexual and reproductive health, or SRH, products. We will examine how these products have evolved historically, the challenges of defining and marketing them, and how modern approaches now integrate medical interventions with wellness-focused solutions. By the end, you'll understand not just what SRH products are, but also how they are shaped by science, technology, and societal expectations. Historically, healthcare products were tightly associated with medical treatments, medications, surgical procedures, and medical devices. The focus was largely reactive. Products existed to solve a problem after it appeared rather than prevent it. For example, feminine hygiene products in the mid-20th century were marketed with extreme discretion, often hidden in opaque packaging. The idea was to make menstruation invisible because of social taboos. Patients were viewed primarily as passive recipients of care, following healthcare providers' instructions with little personal input. This approach reflected a narrow view of healthcare as purely clinical. However, over the years, healthcare began to adopt a broader, more proactive perspective focused on wellness, prevention, and empowerment. The focus of healthcare has shifted from merely treating illness to promoting overall well-being. Today, SRH products include preventative and lifestyle-focused tools. For instance, fertility tracking apps allow individuals to monitor cycles and ovulation, helping plan pregnancies or prevent them naturally. Wearable devices can track physiological signals, like basal body temperature or heart rate variability, to support reproductive health. Telemedicine platforms provide counseling and education without requiring in-person visits. This shift reflects a broader cultural change. Healthcare is no longer only about curing disease. It is about empowering individuals to understand and manage their reproductive health proactively. But with this broadening comes a challenge. How do we even define what counts as a healthcare product? Healthcare products are not always tangible items. Often they are services, technologies, or experiences. This intangibility makes them difficult to define. Moreover, the ecosystem involves multiple stakeholders: patients, healthcare providers, insurers, policymakers, and even advocacy groups. Each has different expectations. Patients want empowerment and clarity. Providers seek safety, efficacy, and workflow efficiency. Insurers focus on cost-effectiveness and outcomes. Policymakers prioritize public health outcomes and regulation. Balancing these conflicting needs complicates the definition of healthcare products. A single product might be a medical device, a software platform, and a service simultaneously. To understand this better, let's look at stakeholder perspectives in more detail. Patients. They want personalized care that empowers them to make informed decisions. For instance, a fertility app expects actionable insights, not just raw data. Providers, clinicians focus on efficacy, safety, and integration with clinical workflows. They want to know that a product works consistently and fits within their care protocols. Insurers look at return on investment, population-level impact, and cost containment. A product that reduces the incidence of high-risk pregnancies, for example, is more appealing. Policymakers, concerned with public health outcomes, regulation compliance, and equity, they ensure that products are safe and accessible, especially to marginalized populations. Each perspective informs how SRH products are developed, marketed, and delivered. These multiple viewpoints underline why defining healthcare products is challenging. Defining healthcare products is complex due to three major factors. Complexity. Products often combine technology, professional services, and patient engagement. For example, IVF treatment involves lab processes, medications, and patient counseling. Intangibility. Many products cannot be touched or seen. Apps, counseling, or educational content are experiences rather than physical goods, which makes conveying their value difficult. Evolution. The field of reproductive health evolves rapidly. New scientific discoveries and technological innovations continuously redefine what is possible. For instance, egg freezing and AI-based fertility predictions didn't exist a decade ago. One of the most critical design challenges is balancing standardization with customization. In developing SRH products, one of the most critical challenges is balancing standardization and customization. Both are essential, but they serve different purposes. First, standardization ensures safety, quality, and consistency across all patients and settings. It provides regulatory compliance, which is crucial for medical products. Builds clinical trust, as standardized procedures and protocols are evidence-based. Example, IVF protocols are standardized to control hormone doses, lab procedures, and embryo handling. This ensures consistent success rates across different fertility clinics. Customization addresses the unique needs of individual patients, taking into account their physiology, preferences, and medical history. It improves patient satisfaction and engagement, enables a more personalized healthcare experience, which is especially important in reproductive health, where emotional and physical differences are significant. Example, personalized hormonal stimulation for IVF cycles, or fertility apps that adapt to a user's menstrual cycle patterns. Even with well-designed products, communicating their complexity is another major challenge. Healthcare products, especially in sexual and reproductive health, often involve complex biological processes and technical procedures that patients may find difficult to understand. Communicating these products effectively is essential for patient engagement, trust, and informed decision-making. Challenges: technical nature. Many SRH products rely on advanced medical science, e.g. hormone therapies, IVF, or genetic testing. Patients may feel overwhelmed by scientific jargon. Perceived intangibility. Services like counseling, fertility tracking apps, or telemedicine are experiences rather than physical goods, which makes their value harder to convey. Emotional sensitivity. Topics like infertility, miscarriage, or sexual health carry emotional weight, requiring careful, empathetic communication. Strategies for effective communication. Visual aids. Diagrams, animations, and videos can illustrate complex processes. For example, animation can show how egg freezing works step by step, which can simplify a complex procedure and reduce patient anxiety. Analogies and metaphors. Relate biological processes to everyday concepts. For example, explain follicle development as seeds growing in a garden. Storytelling. Patient stories or case studies make technical concepts relatable and memorable. Interactive tools. Apps or simulations allow patients to actively engage with their own data, fostering understanding. Example, the Womb Stories campaign uses animation to visualize menstruation, miscarriage, or reproductive anatomy in a sensitive and relatable way. This approach turns abstract biological concepts into tangible and emotionally resonant experiences. The pace of technological innovation further complicates this landscape. Sexual and reproductive health products exist in a rapidly evolving landscape due to continuous advances in medical research, technology, and societal expectations. This dynamic nature makes product development, marketing, and communication both exciting and challenging. Key points: technological advancements. New devices and digital solutions are constantly emerging. For example, femtech innovations like smart pelvic floor trainers, AI-based fertility prediction tools, and at-home hormone monitoring kits were almost non-existent 10 years ago. These products change how patients manage reproductive health, offering more personalized and accessible solutions. Scientific research. New discoveries in reproductive biology, genetics, and endocrinology continuously influence product design. For example, advances in egg freezing techniques and embryo selection algorithms improve outcomes and expand patient options. Changing patient expectations. Patients now demand more personalization, convenience, and transparency. For example, fertility apps now offer real-time tracking, predictive insights, and community support, reflecting user expectations for engagement and empowerment. Regulatory and market shifts. Products must adapt to changing regulations, cultural norms, and market trends. For example, digital sexual health platforms must navigate censorship rules while maintaining clear educational messaging. This evolving environment directly affects how SRH products are marketed and communicated, which we will explore in the next slide. The rapid evolution of sexual and reproductive health products has significant implications for marketing and communication strategies. Today, it is no longer enough to simply promote a product's existence. Marketers must communicate value clearly, ethically, and in a way that resonates with diverse audiences. Key implications: complex messaging requirements. SRH products often involve scientific, technical, and procedural information that patients may find difficult to understand. For example, IVF procedures require patients to grasp hormone protocols, egg retrieval processes, and success rates. Marketers must translate this into simple, reassuring language without oversimplifying. Stakeholder engagement. Marketing must address multiple audiences simultaneously: patients, providers, insurers, policymakers, and even advocacy groups. Each has different expectations. Patients want empowerment and clarity. Providers seek efficacy and safety and practice efficiency. Insurers look at
Ethical responsibility. Healthcare marketing carries a higher ethical burden than consumer products. Claims must be evidence-based, transparent, and free from exaggeration or health washing. Example: campaigns promoting herbal supplements for fertility must avoid making unverified claims that could mislead patients. Navigating social taboos and regulatory restrictions. SRH topics often face cultural stigma and digital platform censorship. Words like vagina or sexual health may be flagged as inappropriate. Example: platforms like Thinks and Flow focus on educational framing and creative design to normalize discussions while avoiding platform restrictions. Adopting to technological trends. Marketing strategies need to leverage new communication channels, such as social media, mobile apps, and interactive platforms. Example: Instagram stories, TikTok educational videos, and AI-powered chatbots are increasingly used to engage users and provide tailored information. The next step is to consider how these principles influence the definition and messaging of SRH products, which we'll explore in the next slide. Marketing should focus on benefits: treatment, prevention, or wellness. For example, a fertility tracking app isn't just a tool, it's a way to increase body awareness, improve planning, and reduce anxiety around reproductive health. Messaging should highlight the functional, emotional, and social benefits. Communication strategies are essential for making products relatable. Effective communication is essential for sexual and reproductive health products because they often involve complex biological processes, sensitive topics, and intangible services. Clear communication ensures that patients understand, trust, and engage with the product. Key strategies for effective communication. Visual storytelling. Use animations, diagrams, and videos to make biological and technical processes understandable. Example: explaining how egg retrieval works using an animated sequence can simplify a complex procedure and reduce patient anxiety. Patient testimonials. Sharing real-life experiences builds credibility, relatability, and trust. Example: a video of a woman describing her journey with a fertility tracking app helps others understand its practical benefits and emotional impact. Interactive content. Tools like quizzes, simulations, or app-based trackers actively engage users and help them understand their own health. Example: a fertility app that lets users log cycle data and receive personalized insights encourages hands-on learning. Storytelling techniques. Present information as a narrative to make content memorable and emotionally resonant. Example: campaigns like Womb Stories use animation to depict menstruation, miscarriage, or reproductive anatomy in a sensitive and relatable way. Simplified, clear language. Avoid medical jargon. Use accessible, patient-friendly terms. Example: instead of saying folliculogenesis, explain it as the growth and development of eggs in the ovary. Once communication is clear, the next step is to focus on building trust and transparency, which ensures patients feel confident in the product and the brand. In sexual and reproductive health, or SRH, trust and transparency are essential for patient engagement and long-term brand credibility. Unlike ordinary consumer products, healthcare products directly affect people's bodies and well-being, making ethical communication and transparency non-negotiable. Key elements. Accuracy and evidence-based claims. Avoid exaggeration or misleading claims. Example: marketing an herbal supplement for fertility without clinical evidence is misleading. Instead, highlight only scientifically validated benefits. Collaboration with healthcare professionals. Partnering with clinicians ensures that messaging is medically accurate and credible. Example: fertility apps or IVF clinics often include OBGYN endorsements, videos, or co-created content to reassure patients. Clarity and transparency. Clearly communicate what the product does, its limitations, and expected outcomes. Example: IVF clinic campaigns include success rates, possible risks, and the number of treatment cycles needed, providing realistic expectations. Patient-centered approach. Listening to patients, acknowledging their concerns, and addressing misinformation fosters trust. Example: Q&A webinars or interactive chatbots allow patients to ask questions and receive accurate answers in real time. While building trust is critical, marketers also face the challenge of navigating social taboos, which we'll explore in the next slide. Marketing sexual and reproductive health products often involves navigating cultural sensitivities, social stigma, and platform restrictions. Many topics, such as menstruation, contraception, or sexual health, remain taboo in some societies, which affects both messaging and accessibility. Key challenges: cultural and social stigma. Conversations about reproductive health are often considered private or uncomfortable. For example, in some communities, openly discussing periods or contraception is frowned upon, which can make marketing sensitive products difficult. Platform restrictions. Digital advertising platforms like Google, Facebook, or Instagram may flag words like vagina, sex, or sexual health as inappropriate, limiting reach. Emotional sensitivity. Topics like miscarriage, infertility, or sexual dysfunction require careful, empathetic communication to avoid distressing patients. Strategies to navigate taboos. Educational framing. Use neutral, informative language that focuses on health and well-being rather than sexual content. Example: terms like intimate health or menstrual wellness are more widely accepted and reduce censorship. Creative visual and design approaches. Use bold, artistic, or playful visuals to normalize topics without relying on explicit terminology. Example: Thinks underwear campaigns use colorful, humorous, and empowering visuals to address menstruation in a stigma-free way. Storytelling and personal narratives. Sharing relatable experiences humanizes the topic and fosters empathy. Example: social campaigns featuring real users discussing fertility journeys or period experiences help normalize conversations. Community engagement. Partner with influencers, educators, and local organizations to reach audiences in culturally sensitive ways. Example: TikTok creators who discuss menstrual health or menopause provide educational content while reducing stigma. Once the stigma is addressed, the next step is understanding your audience deeply to create targeted and effective messaging, something we explore in audience segmentation. Effective sexual and reproductive health marketing requires a clear understanding of audience needs, values, and behaviors. Different demographic groups have distinct priorities, motivations, and communication preferences, which should shape product messaging and delivery.
Segmentation by generation and needs. Gen Z, born around 1997 to 2012, and millennials, born around 1981 to 1996. Values: holistic wellness, sustainability, technology integration, inclusivity, and destigmatization. Communication preferences: social media, apps, interactive digital content, and peer-to-peer testimonials. Product examples: menstrual cups and sustainable period products, fertility tracking apps with AI insights, telemedicine platforms for sexual health consultations. Messaging focus: empowerment, convenience, lifestyle integration, and emotional connection. Gen X, born around 1965 to 1980, and baby boomers, born around 1946 to 1964. Values: clear medical authority, preventative care, reliability, and personalized guidance. Communication preferences: direct information from healthcare providers, brochures, webinars, or informative websites. Product examples: menopause management programs,
preventative screenings like pap smears or mammograms, traditional fertility services with detailed medical guidance, messaging focus, trust, clarity, proven efficacy, and expert endorsement. After identifying audiences, organizations must manage diverse product offerings to ensure a cohesive and effective SRH portfolio, which we explore in the next slide. Managing sexual and reproductive health products, or SRH, requires a strategic approach because healthcare organizations often offer a diverse portfolio of services, technologies, and wellness solutions. Product mix management ensures that these offerings work together to provide a cohesive patient experience while meeting clinical, commercial, and regulatory objectives. Key considerations: diversity of offerings. SRH providers often manage a wide range of products, including medical interventions, IVF, hormonal therapies, contraceptive procedures, wellness programs, fertility tracking apps, prenatal classes, pelvic floor training, support services, counseling, telemedicine, patient education platforms. Example: a hospital fertility center may run an IVF clinic, a digital ovulation tracking platform, and wellness workshops simultaneously. Integration and cohesion. Ensuring that high-tech procedures and wellness programs deliver a consistent patient experience. Example: a patient using a fertility app may be seamlessly referred to in-person IVF services with the same brand tone and patient support system. Brand consistency. All products in the portfolio should reflect the same values, messaging, and clinical credibility. Example: marketing materials for both the IVF clinic and wellness app highlight empowerment, evidence-based care, and trustworthiness. Balancing innovation and core services. Organizations must innovate without compromising the reliability of established clinical services. Example: introducing an AI-based fertility prediction tool while maintaining traditional hormonal monitoring and IVF protocols. Patient-centered approach. Consider how different products interact with the patient journey to maximize engagement and satisfaction. Example: a prenatal class can complement fertility tracking apps, reinforcing health literacy and wellness behaviors. To see these principles in action, let's examine case studies of SRH products, starting with medical interventions. Product: in vitro fertilization, or IVF. IVF is a high-tech reproductive procedure that exemplifies how SRH products combine medical expertise, technology, and patient care. It highlights the challenges of communicating complexity, managing patient expectations, and marketing sensitive healthcare services. Marketing focus: clinical expertise and technology. Emphasize the clinic's experience, credentials of the medical team, and use of advanced laboratory technology. Example: highlighting a lab's state-of-the-art embryo incubators or genetic screening capabilities reassures patients about the quality of care. Success rates and outcomes. Transparency about success rates builds trust while setting realistic expectations. Example: advertising that includes cycle-specific success statistics alongside educational content helps patients make informed decisions. Emotional support and patient care. IVF is an emotionally demanding process. Marketing must reflect empathy and support. Example: sharing patient journeys, counseling options, and support group availability fosters connection and reduces anxiety. Regulatory and ethical considerations. Marketing must comply with health regulations and avoid misleading claims about guaranteed pregnancy. Example: messaging should emphasize probabilities, not guarantees, and include disclaimers where necessary. While medical interventions focus on clinical outcomes, wellness products require a different marketing approach, emphasizing empowerment and lifestyle integration, which we'll explore in the next case study. Product: fertility tracking app. Wellness-focused SRH products like fertility tracking apps highlight a different approach from clinical interventions. Instead of emphasizing medical procedures, these products focus on empowerment, education, and lifestyle integration. Marketing focus: empowerment and body literacy. Encourage users to understand their own bodies and reproductive cycles. Example: apps that track menstrual cycles, ovulation, and symptoms help users make informed decisions about conception or contraception. Daily engagement and habit formation. promote consistent interaction, fostering awareness and healthy routines. Example, push notifications, daily logs, and reminders create a habit of tracking and reflection. Community and support build a sense of belonging and shared experience. Example, online forums or in-app communities allow users to share experiences, ask questions, and receive peer support. Tone and presentation, friendly, approachable, and visually appealing with simple language and interactive features. Example, bright, intuitive interfaces with icons, charts, and tips make tracking enjoyable and easy to understand. Education and prevention. Provide accessible knowledge about reproductive health, fertility, and wellness. Example, informational articles, videos, or quizzes within the app increase health literacy without feeling clinical. By comparing IVF, medical intervention, and fertility tracking apps, wellness products, we see how SRH products exist along a spectrum from clinical precision to lifestyle empowerment. Successful development and marketing require understanding the product type,